Today we're going to be continuing with this discussion of paternalism in medicine. And so we said paternalism is defined as acting in a way that is believed to protect or advance the interest of a person, even if acting in this way goes against the person's own immediate desires or limits the person's freedom of choice. So the basic idea in medicine is when physicians give a patient a treatment or perform a procedure, whether the patient wants it or not. Acting in a paternalistic way, it means not really considering or taking into account a patient's choice and just kind of enforcing a treatment or a procedure or protocol on someone, whether they want it or not. We also looked at a couple of variations of paternalism. We said with weak paternalism, this might be a situation where we're justified in restricting someone's freedom to act if doing so is necessary to prevent them from harming themselves. The idea here is just that it might be okay to take away somebody's freedom of choice when they're going to do something that's very harmful to themselves. Strong paternalism, though, goes a step further and says it's justifiable to limit someone's freedom if by doing so we can benefit them. So the advocate of strong paternalism would say it's okay to take away someone's freedom if in doing so you can bring about some benefit to that person. And so strong paternalism in medicine, it would be like telling a patient that they don't really know what's good for them. And so medical personnel or the medical team, they're going to take away all free choice from the patient and just do something that they think is a benefit to the patient. An example of strong paternalism might be a case in which a patient doesn't want to get a particular vaccine, but doctors go ahead and give it to them anyway. That would be performing a procedure on the patient that the patient really doesn't want, and the physician is doing it because they think it's good for the patient. Or another example that we looked at already is the Dax-Cowart case, where you had this individual who was very badly burned, and physicians continued to treat him even though he said he didn't want any treatment for his condition. Physicians in that case were doing this because they thought it was good for him. So as I said in the last video, strong paternalism seems to be a lot more controversial than weak paternalism. In other words, more people are going to be okay with taking away freedom to prevent people from harming themselves than they are going to be okay with taking away freedom because we think we know better than people what's good for them. Another way of thinking about paternalism is it's a kind of balancing act between beneficence from a physician's standpoint and autonomy from the patient's standpoint. So the physician thinks they know what's going to promote the patient's well-being, and from the autonomy standpoint, the patient may not agree. They may think that the treatment that's being proposed is bad, or they may just not be interested in getting that particular treatment. So we have a clash between what the patient wants, honoring their autonomy, and what the physician thinks is good for the patient. In other words, promoting the patient's well-being or honoring the principle of beneficence. We said also that it seems wrong to give the patient all the power in this situation, but it also seems wrong to give the physician all the power in this situation. So O'Neill in the last video gave us a way of trying to balance the power between the physician and the patient. And we saw with O'Neill's account, she thought that paternalism should kick in to the degree that a patient's decision-making powers are diminished. So if you have a patient whose decision-making powers are declining, that means paternalism has to be increased. So somebody else has to make choices on behalf of the patient because they're losing their ability to make decisions for themselves. On the other hand, if a patient loses their ability to make decisions for themselves because of some sort of injury or illness, physicians or a third party has to step in and make decisions for the patient. But as the patient recovers, as they regain their decision-making powers, their ability to think clearly, to process, to weigh options, the physician has to back paternalistic practices down. So in the Dax-Cowart case, we said it seemed like when he was initially injured, this is a case where paternalism needs to kick into full gear. He can't make any decisions for himself whatsoever because of his condition. But as he was recovering, he was gaining more and more abilities back. He was gaining the ability to think clearly, to weigh his options, and so forth. And so as he was recovering and regaining his decision-making power, O'Neill would say physicians should have been giving him more control over his treatment. Or put differently, physicians should have been backing their paternalistic practices down. Now this proposal by O'Neill seems to work just fine when we're dealing with an adult patient, but when we introduce children who are patients, things get even more complicated. When a patient is a child, especially a particularly young child, they certainly don't have very strong decision-making abilities. You can think of a 2-year-old or a 3-year-old, for example. They can't make good decisions about their own health care. Now, if that's right, then somebody else has to make decisions on their behalf. Somebody has to choose on behalf of the 3-year-old what their diet is going to be like, what medicines they're going to take, which specialists they're going to see. The question, though, is who should make those decisions? Should it be parents or guardians, or should it be physicians? So when it comes to making healthcare decisions for a child, who's in control? And this is obviously going to generate tons of controversy because, again, take the vaccine example. Physicians might think very clearly that it's best for children to get vaccinated according to a very particular schedule, and parents might disagree. They might think that it's actually not in the child's best interest to follow this particular schedule, and so they might even say they don't want vaccination for their children at all. And the question then is, who makes this decision? Can the physician step in and just override the parent's decision and say, look, I don't care if you want vaccines for your kid or not, they're gonna get these? Or do we just listen to the parent and say, okay, well, whatever you think is best, that's what we're gonna do? The problem is that if we give all the power to the parent, that seems to open up the door to all sorts of abuse and children not getting the health care that they need. Whereas if we give all control to the physician, that deprives the parent of their right to raise their children as they see fit. And it might actually cause a lot of damage to the relationship between physicians and communities of people who don't want to just follow whatever the physicians say all the time. If a family is questioning what a physician's recommendations are, and the physician says to them, if you bring your kid to my clinic, here's what I'm going to do, whether you like it or not, that might disincentivize the family from bringing their child to that clinic. And so the child might not get all sorts of other types of health care that they really do need because the family's just too afraid to take the kid to the doctor. So we need to find a way to strike a balance to figure out when, if ever, is it okay for physicians to override the choices of parents. Again, it seems like allowing physicians total control, that doesn't seem reasonable, and giving parents total control, that doesn't seem reasonable either. So we've got to strike a balance. The proposal that we're going to be looking at today for how to strike this balance comes from Douglas Dykema. And so Dykema has three major claims in the essay that we read for today's class. The first is that only in exceptional cases should family privacy be violated. In other words, family privacy, or in this case, a parent's ability and freedom to raise their children as they see fit, the state should get involved and interfere with that only in the most extreme cases. So for the most part, Dykema thinks, the state should not interfere with how families are run. Families should be left to themselves, and so parents should be free to raise their children as they see fit, in most cases. The second major claim that we'll look at is, we've got this question of when should the state interfere, when should the state override parental choice, if ever? And one way of determining when the state should intervene is to appeal to a best interest standard, which says the state should interfere whenever a parent doesn't promote the best interests of their child. Dykema points out that this is not a very helpful standard, though. And then the third major claim is Dykema's formal answer to the main question. So the main question is, when, if ever, should the state interfere and overturn parental choice? Dykema says the state should interfere and overturn parental choice when the harm principle is violated. And that gives us a specific answer to the main question, but then we're going to look at some problems for that answer as well. So turning to the main question, when, if ever, should the state interfere with parental choice to overturn parental choice regarding how parents raise their children? The first claim is that this should only happen in the most extreme circumstances. You might think, for example, that state interference is not warranted in most cases because parents tend to promote the well-being of their children. Or to put it a little bit differently, most parents are doing a good enough job of parenting that the state doesn't need to get involved. Additionally, you might think that parents are the best judges of what's good for their particular children. So different children have different needs. We can't treat all children the same. There's variation in terms of allergies, there's variation in terms of all sorts of preferences, and parents know their kids the best. And so they're going to be the best judge of what's good for a particular child versus what's not good for them. There might also be this idea that parents should be free to raise their children according to their own values and according to their own beliefs. There might just be a general sense that this kind of freedom is an inherently good thing, and so the state shouldn't try to control every aspect of what children believe or how they value things. So again, the idea here is that this type of freedom is an inherently good thing. And you might also think that parents or guardians who have multiple children are going to be the best judges of how to balance the interests of different people in the family. So it might be the case that there are situations where one child needs more attention than another, and making those sorts of decisions about how to prioritize the needs and interests of each child in a family, that's going to be something that parents understand how to do much better than the state does. The state doesn't really have insight into a particular family unit such that they know better than parents as far as how to balance all these interests. So it seems like the default position, at least if Dykema is right, is that the state should just not interfere with parental decisions for the most part. Now, whether you agree with that or not, that's a different issue. We can have the discussion of how much control should the state have over the beliefs and values of children. But I'm going to set that aside for now and just say, for the sake of argument, it seems like the state should not get involved and overturn parental choice in lots of cases. But still, we haven't answered the main question of when should the state intervene to overturn parental choice. All we've said so far is that maybe there are some good reasons to think the state should not do that very often. So when exactly should the state get involved and start overturning parental choices regarding how to raise children? When should the state step in to overturn the decisions that parents make concerning the medical care of children? A common way of drawing this line is by appealing to what's called the best interest standard. And that standard says this: the state is justified in intervening to overrule parental decisions about a child's medical treatment when the parent's decision is not in the child's best interests. So, if a parent makes a medical decision for a child and that decision is not in the best interests of the child, that's when the state has the right to step in and say, no, we're going to overturn the parent's decision and we're going to make a decision that's in the best interest of the child. Identifying whichever action or treatment is in the best interest of the child, though, that's not always going to be an easy thing to determine. We might think, for example, that survival, that's always going to be in the best interest of a child. That's always going to be in the best interest of anyone. So if a parental decision is leading to a child's death, and that death is preventable, this might be a really good case for the state to step in and overturn the parental decision. Because again, you might think that it's always in the best interest for an individual to survive. Survival is kind of a requisite for every other good in your life. You don't have relationships, or you can't meet your goals, or any of those sorts of things if you don't survive long enough to do it. But when it's not a life and death situation, questions about what is in the best interest of the child, that's going to be a lot harder to determine. And one problem here that Dykema raises for the best interest standard is that it seems to be a value judgment. Value judgments are going to vary between different moral perspectives, different philosophical or religious perspectives as well. And so what counts as a benefit? Different people are going to have different ideas about what's beneficial. We looked, for example, at some cases where some people might believe that there's no such thing as physical reality to any sort of disease, and all disease, all illness, all sickness, it's strictly a spiritual matter. If that's true, then what's beneficial for people who are suffering from a disease or an illness is a spiritual treatment, whereas physical treatments, physical medicine, that provides no benefit whatsoever. So already, depending on your worldview, what counts as a benefit, people are going to disagree about that. Another concern for the best interest standard is that physicians might be really tunnel visioned when it comes to what's in the best interest of the patient. They might think strictly in terms of physiological medical terms, whereas there are other aspects of a person's life, not just how well their body is functioning physiologically, but their social interactions and their other opportunities. Suppose, for example, you have a child who develops cancer and a particular treatment for them is only 10% likely to work. If they get the treatment, it's 10% chance they're going to survive, but they're going to have to spend months and months in the hospital. And if we go that route and do the treatment, there's a 90% chance that the child's just going to spend the rest of their life in a hospital. Alternatively, if we don't do the treatment, let's say the child will have another 6 months that they can live outside of the hospital, interact with their friends, do the sorts of things that they love to do. And even though they're not going to survive, they at least get 6 more months of good quality time. So we might ask the question, what's in the best interest of the patient? Is the treatment the best thing for them, even though it's only 10% likely to work, and that means the rest of their life is very probably not going to be as pleasant? Or is it in their best interest to take the time they have left and really enjoy that time? And so this is a really difficult case. Determining what's actually in the best interest of the child is hard to say here, whereas medical personnel might just think the treatment is obviously the right thing to do because that gives the patient some chance of survival. The parents may have a different view though. And so the question is, if the parents say no to the treatment and they say, I just want my child to enjoy the time they have left, can the state step in and say, we don't really care about what the parent's decision was. It's in the best interest of this patient to get the treatment because that gives them some chance of survival. Is that an okay thing for the state to do here? And Dykema's point is, it's really hard to tell. And so again, one worry with the best interest standard is that medical personnel are going to be thinking of best interests in a strictly medical sense, whereas parents might be thinking of best interests in a more broad sense, which includes not just physiological function, but social function and the other sorts of things that are relevant to a person's life. And one last problem for the best interest standard is that parents hardly ever act in the best interest of their children all the time. So for example, it might be in the best interest of a child to have a piece of fruit for a snack, whereas parents might occasionally give them ice cream. And so does the state interfere in these cases? Does the state barge in and say, it was in the best interest that your child eat a piece of fruit for a snack, you gave them ice cream, so we're going to take away control from you and raise your child for you because you're not acting in their best interest? The problem with that is that if it's really true that parents don't always act in the best interest of their child, because it's impossible to do that all the time, then that would just mean that the state would be constantly interfering with family life. And that just doesn't seem like a very reasonable thing to allow. The state shouldn't be constantly interfering and micromanaging literally every single detail of how a child is raised. But if we take the best interest standard literally, it's telling us the state should interfere anytime that parents don't behave in the best interest of the child. So the best interest standard would seem to be promoting a kind of micromanagement of parental decisions. Now, to return to our main question of when, if ever, should the state interfere with parental decisions, particularly about medical care, rather than appeal to a best interest standard which says the state is justified in interfering to overturn parental decisions whenever parents fail to act in the best interest of the child, rather than using that because there's all sorts of problems with it, Dykema proposes the harm principle, which says the state is justified in intervening to overrule parental decisions about a child's medical treatment when the parent's decision is sufficiently harmful to the child. So here we're really lowering the bar. We're not saying parents have to act in the best interest of their children all the time. We're saying parental decisions just can't be too harmful to the child. Once a parental decision becomes too harmful to the child, that's when the state should step in. But in the meantime, whether the parents are acting according to the child's best interest or they're just doing a good enough job, then the state should just leave parents alone. So it's only when parents cause a sufficient amount of harm in their decision making that the state should enter in and overturn parental decisions. And looking at this definition of the harm principle, for something to be sufficiently harmful, that means the decision significantly increases the likelihood that serious harm will occur as compared to the other options. So if the parents are opting to do something that's extremely harmful to the child, then the state should step in and prevent that from happening. Whereas if the parents are doing something that's only mildly harmful, then the state should leave them alone. So for example, if a child were to be choking on a piece of food and parents refuse to let doctors get that piece of food out of the airway, that would be a sufficiently harmful decision that the state should overturn. Whereas when it comes to something like a flu vaccine, by not giving your child a flu vaccine, you're opening them up to unnecessary illness, but that may not be sufficiently harmful to justify the state stepping in and overturning parental decision. So again, the idea is the state should intervene to overturn parental decisions when those decisions expose children to lots and lots of avoidable harms, whereas if parents are exposing their children to minimal harms, then that's okay. And you might think that that's perfectly reasonable. So parents let their children participate in sports all the time, but participating in sports carries with it the risk of injury. So a child might get bruises and scrapes and even broken bones when participating in sports, but we're not going to say to that, okay, the government should step in and prevent parents from allowing their children to play sports. In other words, yes, these activities open up the possibility of minimal harms, but that's not a good enough reason to justify the state taking away parents' decisions here. Now, just to read through really quickly, Dykema gives us 8 conditions that we should consider when trying to assess whether or not a parent's decision is sufficiently harmful such that the state should step in and overturn the parent's decision. So we ask 8 questions, and if the answer to each of these is yes, then that means the state should step in and overturn parental decisions. So the first question, by refusing to consent, are the parents placing their child at significant risk of serious harm? That is, if they refuse treatment, serious harm is going to happen, whereas if they opt to get treatment, serious harm will be avoided. If the answer is yes, then that's some good reason for the state to interfere. We might further ask questions like, is the intervention that has been refused of proven efficacy and therefore likely to prevent the harm? So here, Diochema is saying it's not the case that you have to get a treatment if it's experimental or untested or unproven, but if a treatment is proven, we know it works, and parents are refusing to have that treatment performed on a child that needs it, that gives us some good reason to overturn parental decisions. So we can override parental decisions when they reject a proven treatment, but an unproven treatment, if parents say they don't want their child to have a particular treatment that has not yet been proven, the state doesn't have the same reason to overturn parental decisions. Because the idea here is we shouldn't force children to get treatments that really we don't have any good evidence that they're even going to work. Another question that we can look at is what are the respective benefits and burdens associated with a treatment? If a treatment is proven to work, but it has tons of really bad side effects, whereas no treatment, yeah, that's going to expose the child to avoidable harm, but they also don't have to deal with those side effects. In those sorts of cases, we need to weigh the pros and cons of treatment, and if a treatment itself carries with it too many negative side effects or too many other burdens, then the state doesn't have as much reason to force parents to give their child that treatment. So we need to weigh the pros and cons of treatment versus non-treatment. Another question we can look at, would any other option prevent serious harm to the child in a way that's less intrusive to parental autonomy and more acceptable to the parents? So think, for example, of parents who are against blood transfusions, but their child needs a blood transfusion. We might ask the question, are there any alternatives that are consistent with the parent's worldview here? Are there other types of treatment that can accomplish the same goal of saving the child's life that don't require giving that child a blood transfusion? And if so, we should opt for whichever treatment does the least amount of damage to parental autonomy. So Diochema is saying physicians have to think about all the available options and pick the one that is least likely to overturn parental autonomy or to interfere with parents' worldview. So again, looking at all these questions, what Diochema is doing is saying the state should intervene to overturn parental choice when parents' decisions are sufficiently harmful to the child. And when we're trying to figure out whether a decision is sufficiently harmful, we've got these 8 questions that we can look at, and they help us assess when are the parents' decisions leading to too much harm such that the state should intervene to overturn parental decision. And on the other hand, when are the parents' decisions maybe not exactly what the physicians would want, but those decisions are not causing substantial or significant harm. In those cases, the state doesn't have the same justification for interfering with parental choice. So the idea is if somebody's beliefs, religion, worldview, philosophy, whatever, leads them to do something that would be substantially harmful to their child, that's not a freedom that parents have. And this idea that parents can't expose children to substantial harms, it may tie back to this ruling by the Supreme Court in 1944 that says, the right to practice religion freely does not include the right to expose the community or the child to communicable disease, or the latter to ill health or death. Parents may be free to become martyrs themselves, but it does not follow that they're free in identical circumstances to make martyrs of their children before they have reached the age of full and legal discretion when they can make that choice for themselves. The Supreme Court is saying you're not free to expose children to that kind of harm. Suppose, for example, that an adult believes that there's no value in medical science whatsoever. They might think, for example, that all disease and all injury can be healed through spiritual means alone. Then imagine that this person breaks their arm and it becomes very badly infected to the point where their life is in danger. The Supreme Court is saying if that person wants to live according to their beliefs and they refuse to go to a doctor, they say, I don't want treatment because this is a spiritual matter, there's nothing that medicine has to offer me to fix this problem. The Supreme Court is saying that's fine. You can do that. You're free to do that as an adult. But as a parent, you can't put your child through the same thing. You don't have the same right to make your child go through that sort of experience as you do for yourself. So the idea is you can make a martyr of yourself, you can die for your own beliefs, but you can't make children die or suffer or develop serious illness or injury for the sake of your beliefs. And so Dykema gives this example of the blood transfusion where a child needs a blood transfusion to survive. If they don't get the blood transfusion, they're going to pass away very soon. And here's what Dykema says. Treatment provides great benefits, namely the prevention of death, and imparts a minimal risk of harm. Blood transfusions are very safe, they're proven, they're effective, and so the state seems justified in this case to overturn parental decisions. If parents say they don't want their child to receive a blood transfusion, this is a known treatment, it's proven, it's effective, it's minimally risky, it's not going to cause the child harm, whereas not treating them is going to cause a serious harm. So Dykema thinks the state should intervene here. A problem here, though, and this is a problem raised by Anita Caitlin, is that this seems to ignore the parent's own religion or worldview. So let's back up and think about the situation from the physician's standpoint. We've got two options here. We either treat and give the child the blood transfusion, which saves their life, or we don't treat, which means the child is going to die of their condition. So we can bring up the principles of principalism here. So what does beneficence say here? Well, we're supposed to promote the well-being of the patient. That means we should treat because allowing the patient to survive is very much promoting their well-being. What does non-maleficence say here? Well, we're not supposed to expose a patient to unnecessary harms. If we don't treat, that leads to the patient's death. That's obviously a serious harm, and so it's avoidable. We should not expose the patient to that harm. What does justice tell us to do? We might think to ourselves, anytime a child needs a blood transfusion like this, which is very easy to obtain, it's safe, it's proven, it's effective, we should give a child that treatment. And so justice tells us the right thing to do here is to treat. And then autonomy, that's tricky. If we're talking about the parent's autonomy, that would seem to indicate we shouldn't treat because the parents are saying no to the treatment. But if we're thinking about the child's autonomy, their ability to make decisions for themselves, especially in the future, the idea is they don't have the ability to make decisions for themselves yet, but they're going to develop that. And so for the sake of their future autonomy, we might think the right thing to do here is to treat. So all four principles seem to give us some reason to treat the patient. But then let's suppose that we exit the physician's point of view, and we set that aside altogether, and we enter into the parent's point of view. The parents in this case might think that treatment, getting the blood transfusion, is going to lead to eternal suffering for the child. Whereas withholding treatment, yes, that's going to lead to the child's death, and that's a very serious harm, but it's not nearly as bad as eternal suffering. And so let's bring up the principles from Principalism again here. Non-maleficence is really easy. Non-maleficence tells us we shouldn't expose people to unnecessary harms. Which is the greater harm here? Eternal suffering or death? And the parents are going to say eternal suffering is obviously a more harmful outcome than death, and eternal suffering is avoidable. So if we don't give the treatment, the child has a chance at avoiding this eternal consequence. That means non-maleficence from the parent's point of view says don't treat the patient. Beneficence is going to echo the same sort of thing. What promotes the well-being of this patient? Eternal suffering or death followed by a pleasant afterlife? Beneficence is going to be very clear. The right thing to do here is not to treat. What about justice? Well, there might be something profoundly unjust from the parent's point of view when it comes to interfering with an individual's afterlife. And when it comes to autonomy, the parents are the decision makers for the child. This is their child. They're in charge of raising this child. They're saying very clearly they don't want the treatment. This is their choice. So autonomy is saying we shouldn't treat. So from the parent's perspective, you can use all the same principles from Principalism, and all four suggest that the best option is to not treat. What this means then is that Principalism can serve either side. So we've got these four principles: non-maleficence, beneficence, justice, autonomy. Those principles can be used by different people to arrive at completely different conclusions about what the right thing to do is. All four principles from the physician's standpoint suggest that treatment is the right option here. All four principles from the parent's standpoint suggest that not treating is the right thing to do here. And so Principalism is just being used as a tool by whichever party happens to be wielding it. So there's really two worries here. The first is for Dykema, which is assessing what counts as a harm or not. That's going to be very much a value judgment, just like assessing best interest was a value judgment. What counts as a harm is going to be determined in large part by one's wider worldview, one's religious perspective or ethical or moral perspectives. So what counts as a harm, that's going to be dramatically influenced by a person's worldview. physicians might just take a very different perspective of harm than parents. But the question is, who's right? And that may not be a question that we want the state answering. So if the state is supposed to be neutral with respect to which religious perspective or which moral perspectives are correct, then it's not the place of the state to say the physician's worldview is right and the parent's worldview is wrong. That would be taking a side against a particular religion. The second problem, which is maybe a bigger problem in general, is that principalism is supposed to help us in these situations to come to a reasoned decision, to give a justified explanation of why we act like we do. But as we've just seen, principalism can be co-opted into various worldviews to arrive at very different conclusions. The physicians can use all four principles to explain why treatment is the right option. The parents can use all four principles, the same principles, to explain why not treating is the right option. And so principalism by itself doesn't seem to be able to break the tie. So not only do we have problems for the harm principle, but we have problems for principalism that start to show up when we're actually putting it to work. And I think one thing that will help here is grounding principalism in a normative theory. So this is in part why we spent so much time at the beginning talking about normative theories. When it comes to breaking the tie between different ways that principalism is being used, we can appeal to a normative theory to try to explain why one interpretation of beneficence or one interpretation of non-maleficence is more reasonable than another. Now that's just a suggestion, it's just an idea I'm throwing out, but in any case, just to recap, this is our second discussion on paternalism. It's focused on cases where you have not just a patient and a third party, but now we have a patient, a physician who's deciding one course of action, and the patient's parent who wants to opt for a different course of action, and we're asking the question, who should we give power to? Should we empower the physician or should we empower the parent? We saw that in general, at least if Dykema is right, generally speaking, parents should be given the power to control and raise their children as they see fit, whereas the state shouldn't interfere a whole lot. Then when it came to the question of when should the state interfere, we saw the best interest standard says the state should interfere whenever parents fail to act in the best interest of a child. We saw that there's problems with that. Dykema proposes that the state interferes when parental decisions lead or expose a child to significant amounts of harm. That's a more promising view, it looks like, than the best interest standard, but there are still problems because what counts as a harm is going to be dramatically influenced by different religious and moral and philosophical perspectives. And so the question is, do we really want the state to be taking sides in this matter? On one hand, if the state does take a side and says certain moral perspectives are just incorrect, then it may be the case we can prevent a lot of harm and suffering, but we're also bulldozing religious freedoms. On the other hand, if we don't want the state to pick a side in these matters, then we're promoting religious freedom and a pluralistic society, but that's exposing people to lots of harms that are avoidable. And so rather than resolve that tension, I want to see what you have to say about it. What do you think is the more reasonable thing for the state to do in these cases? Do you think the state should take a side and say that in the blood transfusion case, the parents are just wrong? Or do you think the state should say, we can't choose one way or another whether or not the parents are right or wrong, so it's going to be left up to the parents to decide what they think is best? Or how you think we might strike a balance between those two options? So I'll leave it at that. Any questions, comments, or concerns, leave them on the discussion board, and I will talk to you there.